for being here and setting aside a summer evening to think about and discuss COVID. It's incredible that people are willing to take the time out of their own lives to do this and help each other out and hopefully have some better outcomes in New Brunswick and in the Atlantic region. So my name is Kathleen and I am with Protect Our Province, New Brunswick. We also have people here tonight invited from Newfoundland and from Nova Scotia and from PEI. And we're joined this evening, the reason that we're all here tonight is that author Jon Parsons, who is originally from Newfoundland, is going to give about a 30-minute presentation about what's happened in the region, helping us to kind of look back at what's happened and think about what's coming next. And so he's going to give, once I finish speaking, he's going to start his presentation. And then at the end, we can have a question and answers and discussion. And so please do save your questions for the end. I'd like to allow Jon to deliver the material that he has prepared. If you would like to ask a question anonymously and not have it come up associated with your name, you can send it to our moderator, Teresa. And I believe that Teresa's name on the list, if you're looking to direct message her, comes up as Tree, T-R-E-E. So if you would like to ask a question or say something anonymously, you can do that tonight through Teresa, and her username is T-R-E-E. And she's also going to be helping out with keeping track of the order of the questions as they come in. And we can do questions through the chat interface that I can read out to Jon and make sure they're captured, or you can raise your hand. You can use the raise hand function from the menu at the bottom, I believe, to indicate that you'd like to ask a question. So Jon will deliver his presentation and then we can have a discussion. So before we get started, one of the first things that I would like to do is acknowledge that I am speaking to you tonight from the unceded territory of the Mi'kmaq, the Passamaquoddy, and the Wolastoqey people, and that the Truth and Reconciliation process is an ongoing one that personally I endeavor to do more of the actions and the calls to action, and certainly hope that those folks joining us tonight would share in that approach to the unceded territories that many of us are living on and working from. Thank you so much for being here and for joining us. I'm going to just briefly introduce Jon, and then I'll let him speak. I'm sitting outside. I hope that the nature noises aren't going to get too rowdy. I hope the crows will behave for us this evening. Jon Parsons is a writer and he's a researcher, and he's originally from Newfoundland. His research interests are in applied ethics and knowledge mobilization. He has worked as a journalist, instructor, and writer in the university and in the public sphere. He was previously a community organizer and activist with Social Justice Cooperative Newfoundland and Labrador. And so Jon's work, how he came to, I think, many of our attentions was with his work on Twitter, where he's written some really wonderful threads that I think have connected with a lot of people from coast to coast and maybe outside of Canada as well. And Jon's also written a book, and it's COVID-19 and Ethics in Canada. And it spans from the earliest days of the pandemic up until now, the kind of really difficult period that I think that we find ourselves in, that I think a lot of us, government refers to as living with COVID times, which really seems to be just letting it run roughshod over us. So with all that said, I am going to mute myself, and please do keep your microphone muted unless it's your turn to ask a question. I'm going to mute myself and turn things over to Jon. So thanks, Jon.
Okay, thank you very much, Kathleen. And just let me see if I can share my screen here now. I will get a little presentation. So yeah, once again, thank you very much, Kathleen. And thank you to all the folks at Protect Our Province, New Brunswick, for the great work that you're doing. One of the first presentations I gave, just as the book was coming out, was for Protect Our Province BC. So I think I'm going to try to do the whole circuit of the Protect Our Province organizations over the next little while. So the presentation that I have for you this evening is, it's based on my book, but it's specifically going to look at some of what's happened in Atlantic Canada. So I'm going to jump right into it, but very quickly, the first things that I'm going to do is give a little of the context of the book and sort of the ethical framework that I mobilized for the book. Then I'm going to look at some of the specifics of what's happened in Atlantic Canada, and especially in the last 3, 4, 5 months in Atlantic Canada. And then I'm going to talk a little bit about some of the implications of the failure of the pandemic in Atlantic Canada and across the country. So just very quickly, once again, Kathleen has covered a lot of this, but I am a Newfoundlander by birth. I'm currently living in Ontario. I'm in Kitchener-Waterloo right now. For the first year and a half of the pandemic, I was in Toronto. And for the last 9 months or so, as I say, I've been in Kitchener-Waterloo. So I am an academic by training. I completed a PhD at Memorial University in Newfoundland, where I worked in resistance studies. I also study applied ethics and knowledge mobilization. I've also been writing journalism for some 10 years. Now, the genesis of the book, COVID-19 and Ethics in Canada, it didn't start as a book. It started as a series of editorials that I began writing as soon as the pandemic started in March of 2020. I published a number of articles in a Canadian independent media outlet called Ricochet, and others in The Independent, Newfoundland and Labrador, which is an outlet I've been publishing with for many years, as well as a few articles in CBC and other media outlets as well. So that moment in March of 2020 was a very difficult moment, I think, for an awful lot of people. There was a great deal of uncertainty, and people didn't really know where things were going to go or how we were going to deal with this emergent problem that we were all facing, that the world was facing. And so what I wanted to do was set out to write articles that took topics from ethics and from philosophy, and that were able to be then presented in a public form so that it was something that people could use, so that they could apply in their own life. And they were supposed to be short articles, very straightforward, about social solidarity, about collective values, collective care, the kind of attitudes that I think would have made a difference through the pandemic. Now, a lot of the pandemic story has been told through the lens of data. So there's graphs, and charts, and numbers, and statistics for everything, for statistics for infections, infection rates, the epidemiology, statistics around the deaths. All of it has been data-driven. Now, we need the data. The data is very important in terms of how we make decisions, and in order to drive the best decisions, we need good science and good data. And I'm not saying that we don't need the data and the scientific information, but I have felt from the very beginning, and I still feel today in many respects, that helpful voices from the humanities and social sciences have been missing from the conversation, and that could have helped us think about the way that we comport ourselves and the way that we act as human beings and as communities through the pandemic has been sort of washed out by the sheer amount of data-driven narrative that we see in the media primarily. So once again, my intervention and what I tried to bring forward in the work that I'm doing was to bring a lens of applied ethics. So to bring ethical and philosophical ideas into the public discussion, so we could talk about, the way that we live with COVID-19, so to speak. So very quickly, and again, this is not an academic presentation, and the book is not an academic book, but I do draw on the philosopher Simon Critchley's work, and especially his work in the book Infinitely Demanding. Now, Critchley's work is interested in positing a subject for political change. So he's interested in what kind of communities, what kind of people, what kind of subjectivity, as it were, would be most helpful for creating political change and achieving social justice politically. What I've done in my work is taken Critchley's ideas and his work on ethics, and then applied that same framework to COVID-19 and to the pandemic. So 3 forms of subjectivity that Critchley describes, and that then I take and apply to the pandemic, are passive nihilism, active nihilism, and ethical subjectivity. And I believe that these 3 go some way to explaining an awful lot of the behavior that we've seen throughout the pandemic and that we continue to see today. So passive nihilism is subjectivity, or a person, who witnesses and sees that the world around them is in chaos, and they realize that there's not an awful lot that they as an individual can do to fix the situation. And in response, they turn inward and sort of focus on the self. So passive nihilism is a kind of hedonism. So in the context of the pandemic, the passive nihilist is someone who really needs to go out to brunch, or who really needs to get their hair cut, or who really wants to go on holiday in the midst of suffering and disease. So the focus on the self is what is most important. The active nihilist, in the context of the pandemic, is a subjectivity that likewise recognizes that the world around them is in chaos, and that there's not an awful lot that they can do as an individual to make any big change. But whereas the passive nihilist sort of turns inward and makes it about themselves, the active nihilist lashes out, and specifically lashes out at anyone who's trying to do anything to keep their community safe. So in the pandemic, the active nihilist is someone who protests against any mandates, or protests at hospitals, or is against anything to do with trying to keep communities safe in the pandemic. Now, opposed to these 2 nihilisms, or contrasting these 2 nihilisms, is what I call ethical subjectivity, or what Critchley calls ethical subjectivity. Now, in the context of the pandemic, the ethical subject, in fact, recognizes the very same things as these 2 forms of nihilism. So the ethical subject recognizes that the world around them is in chaos, and that there's not an awful lot that they as an individual can do to try to make things right. But whereas the 2 nihilisms sort of give up and turn inward or lash out, the ethical subject commits to trying anyways. So the ethical subject is the one that, of course, I recommend, and that I think would have made a big difference throughout our country in the pandemic. And as I'm going to describe in just a minute, I think that part of what explains some of the variation in the way that the pandemic has been experienced in different parts of the country is the degree to which communities have this ethical subjectivity, or the degree to which some communities have better collective care. Now, before I move on, I just want to say that naming these subjectivities and talking about ethics in this manner is not about blaming people. So I'm not here or ever going to blame the passive nihilist or the active nihilist for the way that they've acted. This is a story of imperfect people who were faced with a very difficult situation and did what they thought was best in their own context and in their own lives. Also, I should just say as well that nothing about this sort of subjectivity or the way that people responded to the pandemic, I don't take any of that as a statement on human nature. I don't think there's anything that means or that says that we must have failed or that these failures must have happened because there's something inherent in the way that people are. I think that we have the capacity, all of us, to do better or to do better next time, so to speak. Now, moving on to the discussion of what's happened in Atlantic Canada. When my book first came out, and this was in March of this year, on the 2-year anniversary of the pandemic, I did a number of media interviews in my home province of Newfoundland and Labrador. And at that time, I spoke a little bit about what I was describing as the pandemic success story in Atlantic Canada. And a number of people helpfully got in touch with me and pointed out that, you know, they didn't think it was a success, that there had been problems all along in a lot of Atlantic provinces, and I agree. And I'm not saying that everything was perfect in Atlantic provinces throughout the first 2 years of the pandemic. So in Newfoundland and Labrador, for example, there was some big missteps, even in this period of time, that I think I would call something of a success. There was an election that the government there called and then got hit with a bad outbreak, and a couple of other issues that came up as well. In New Brunswick, I think there's question marks all along around the way the provincial government there has shared information, or the degree to which the government there has been transparent in the way that it's reported or communicated with people about the pandemic. And similarly, in Nova Scotia and Prince Edward Island, I think there's been question marks all along. But that said, compared with what has happened in other parts of Canada, for that first 2 years or so of the pandemic, the Atlantic Canada story was a remarkable success. And I can say that as someone who lived through this in Ontario and observed very closely what was happening in Newfoundland and Labrador. It was remarkable to see the difference in the data and in the way that people were describing their lived experience of the pandemic in Atlantic Canada versus here in Ontario. And I know a lot of what I heard from folks in British Columbia and Alberta and other provinces where things have been, frankly, a nightmare right from the very beginning. Essentially, there was the same public health measures in a lot of these places. Here in Ontario, the same public health measures were on the books as were in many Atlantic provinces, and yet the results were starkly different. And I think it's important to ask the question of why. Now, the answer that I come to in my own research and in my own work is around the ethics of collective care and ethical subjectivity. Now, once again, I'm not saying that this was everybody or that everybody did everything that they could throughout that first 2 years of the pandemic, but I think small differences matter. And I think having a little bit more what's called social cohesion or social solidarity in communities, you know, the idea that people in communities can know that their neighbors at least have their backs, or that, you know, we can rely on one another when times are tough. And I think this can make a big difference. So there is a big body of research that is currently being done. There's some early research has been coming out, but the pace of research, and certainly a lot of social science research, because the process is so long in doing this, is a little bit slow. But one recent paper, and it's out there freely available online, looking at Nova Scotia Strong and the way that played a huge part in Nova Scotia's pandemic success, at least in that first couple of years. And there's a great deal of research being done on this because it is a huge question, and it is of great interest, and I think enormous value to try to understand the answer to this question of why some regions did so much better than others. Now, as everyone in Atlantic Canada knows all too well, that success very quickly turned to failure. And this sort of started around the end of 2021 and the first few months of 2022, when Atlantic provinces, one after another, removed all of the protections that were in place and all the public health measures that were in place and went about dismantling their reporting and really their tracking of what was happening at all. So there was this quick shift, as I describe it, from that relative success to this fend for yourself, or so-called learning to live with it approach to the pandemic. And a lot of people in Newfoundland and Labrador have described it to me, and from what I've heard in other Atlantic provinces, the same sort of thing, that the quick shift from that sort of relative success to this fend for yourself kind of approach was like having the rug pulled out from underneath people. And I've described this as pandemic whiplash. So this quick shift really hits people hard, and it makes it obvious that something big and important has changed. I've heard it described as the feeling of being abandoned, and especially by some of the leadership and public health leadership who were for so long, the ones who were promoting social solidarity and social cohesion. In Newfoundland and Labrador, the chief medical officer of health there became something of a folk hero for the first 2 years of the pandemic, and was one of the most famous people, I'm sure, that has ever lived in the province, and would never have paid for a beer anywhere around St. John's, I'm sure, for the rest of her life, except for the fact that this shift happened early in 2022, and that public health official sort of disappeared off the scene, and the province went about its way dismantling the reporting system and basically said it's up to everybody to just look after yourselves from now on, after having this great focus on social solidarity and collective care all the way through. I've heard people say as well that it made them feel that their efforts at keeping other people safe and at acting ethically, as I would call it, was naive, as though it would have been better if we had just never bothered in the first place, because it makes you feel like you were a sucker for having tried. Now, this is extraordinarily damaging, of course, for a number of reasons, and in some ways, perhaps more insidious and more damaging than what happened in provinces that did fail all along, because in Atlantic provinces, people know that it doesn't need to be that way. So it really undermines and invalidates social cohesion. It really undermines what I would call that ethical subjectivity, or the idea that we ought to try. And just to see then what can so quickly and easily be brought out of our communities and out of one another, out of people that we thought we knew how they were going to act in a situation like this, to see the way that can so easily shift and that people can so easily change is extraordinarily disheartening and extraordinarily disappointing. It's led me to describe this learning to live with it phase of the pandemic, and not just in Atlantic Canada, but in the whole country, as the most brutal phase of the pandemic. The whole idea that we're going to just infect everybody over and over again, this mass infection kind of approach, I think there's no other way to describe it other than brutal and heartless, because it is it's premised on the tacit acceptance that there's certain people that it's okay if they get sick and if they die. And an awful lot of the time, that is some of the most vulnerable people in our societies, so older adults, disabled people, anyone with so-called comorbidities, just the way that it appears that it's appropriate that people are just being sort of thrown to the wolves. At one point in the book, I have a line, I say, how can thoughtful people feel good about participating in a society that has a set of bared fangs? Now, I've tried to categorize some of this, and this is just a list, a rough list in some ways, but I think it goes some way to showing what that catalog of failure is that, we've experienced in Canada, broadly speaking, and also now in Atlantic Canada. So first of all, I think we have to speak about the dead and the number of people who have been sacrificed to this virus. Very often, as I say, they are some of the most vulnerable people in our societies: older adults, children, disabled people, racialized communities, Indigenous communities, working class communities, and people experiencing homelessness. Also, I think there's big issues around the way our country, our federal government, and our country as a whole has acted on the world stage with respect to vaccine hoarding. So Canada was one of the worst vaccine hoarders on the planet. Vaccine inequity, by which I mean the fact that some communities were vaccinated first, very often some of the wealthiest communities, while some of the poorest communities have been the ones that have been vaccinated last, even though infection rates have been lowest in the wealthiest communities and highest in the poorest communities. There's been a real failure of leadership all across the country, and unfortunately, Atlantic Canada, the leadership there has to be added to this list now. At the same time, I think it's important to recognize that there's been a failure on the part of everyday people as well, that people themselves are also responsible, and that it's not enough just to lump all of the blame on the leadership, that people are responsible for the predictable consequences of their actions. Back to those active nihilists, the people protesting on behalf of the virus. Again, while I'm not going to necessarily be here laying blame as such, this is certainly a failure on the part of our society, that there's people who are literally protesting against any reasonable attempts to keep this thing under control. There's some questions around blame shifting and scapegoating, by which I mean that certain communities and certain groups of people have been targeted and blamed for the perpetuation of the pandemic. And even now, absurdly, people who wear masks or who continue to attempt to keep themselves safe can face repercussions in public or having being scapegoated in some ways. There's also the enormous burden of long COVID that I think we're only beginning to understand, and that is going to continue to be a problem for decades, generations, who even knows. Now, the final part of the presentation, I just want to say a few things about the implications of this failure of common decency, as I describe it in the book. First of all, once again, the embodied human harm. I think we always have to start with that, the people who have died, the people who have been infected, the people who have been disabled by this virus, and that, has been enabled by the way that our country has acted, our governments have acted, and that our communities themselves have acted. So that embodied harm, I think, always needs to come first. There's also something to be said for the breakdown of social relations. And I touched on this very briefly when I said that, in Atlantic Canada, with that quick shift from having something like an ethics of collective care to now having this sort of fend for yourself approach, people start to question those who maybe they had confidence in before. And all across the country, this has been happening throughout the pandemic. Here in Ontario, it's been since day one, I would say. But people, are experiencing this breakdown of social relations, even in families. So a lot of families, a lot of friend groups, workplaces, wherever it is that people have, relationships with one another, people are questioning what they think they knew about their friends, their families, their coworkers, their bosses, whoever, because they've witnessed the way that they've acted throughout the pandemic. And then the flip side of that coin is that there's some folks who will look at the way that people are continuing to exercise caution and think that that's going too far. And so this has had an enormous impact and done enormous damage to all kinds of social relations. There's also something to be said about the disruption of Canadian and regional identities. So Canadians like to think of themselves as living in egalitarian sort of communities. They like to think of themselves as having values around humanitarianism, and that things like public health are actually important values that we hold as a country, or as, even regional identities have the similar sorts of values. So that is really undermined by what's happened in this pandemic. So it makes it a lot harder to believe in some of those narratives of this is who we are as Canadians, or this is who we are as Newfoundlanders, or this is who we are as Nova Scotians, or whatnot. It undermines all of that. And those things actually do an awful lot of heavy lifting in this country, that people believe in something and they believe they're participating in something like a Canadian project, as fickle as it may be at times. That can be a very damaging thing if it becomes undermined in this country. There's implications as well, social, political, and economic instability. I think we've all seen firsthand, of course, a lot of the economic instability that's resulted out of the pandemic, the inflation crisis that just continues, the way that there's been disruptions in most all workforces, but most especially in healthcare fields, the almost collapse of a lot of healthcare fields. So there's enormous instability and enormous unrest that's been caused in all levels of Canadian society, politics, and economics. There's also something to be said about the fact that this failure on the pandemic telegraphs a failure to address other issues as well. So they say that the best predictor of future behavior is past behavior. So if we were not able to deal with this pandemic, what does that say then about our ability to deal with something like climate change? Or what does it say about our ability to deal with something like reconciliation, which I think is a burning issue in this country? So we failed here. It means it's going to be that much harder to mobilize efforts around any of these other issues. So what can be done? This is the question that I get all the time. What do we do about it? What can we do next? And I must say, without wanting to sound terribly morose, that this whole experience has been an enormous disappointment for me. And I say this as someone who worked as a community organizer in my home province for almost a decade. Out in the grassroots, trying to make positive change, trying to make change for social justice in my community. Seeing what has happened through this pandemic has made me question some of my beliefs about my own community, about my country, and about where we're going. So it's difficult for me to draw a lot of silver linings out of this, and I don't feel the need to mince words about that. However, I think that if there's one good thing that we can take away from this, it's that we know now what we need to do. We know that we need to have some sort of a movement or some sort of a groundswell or something that needs to come out of the people themselves that is made of principle and that is made of ethics and that is driving towards the kind of values that would have made a difference throughout the pandemic. So these values around collective care, these values around what I call ethical subjectivity. And frankly, the reason that I love coming and speaking to organizations like this is because it's the values that these type of organizations embody. So I think we see in groups like this exactly the kind of model of those values that we need if we want to make anything better in this country or in our communities. So I say at one point in the book, in a situation like the one we face in Canada, ethical action is a form of resistance, and resistance is the only ethical option, even if there is little hope any good will come of it. Finally, I think that there is something really important to be said as well about learning from the outliers. So that first couple of years in Atlantic Canada, it may seem like it was a dream, or that it was something that, it's hard to even believe that it happened. But there was a special thing that happened there, and there was something different that happened there, and it was an outlier. And there's a few other of these kind of outliers that we can see around the world as well. And I think we need to look at these examples and try to learn what happened there. And I think it's really important because it resists the narrative of inevitability. It resists the idea that things cannot be otherwise than mass infection, because we've already proven that it can be otherwise. Okay? We've already shown that it doesn't need to be this way, and that there are other things that we can do. There are ways that we can keep each other safe. There are things that can be put in place and ways that communities can care about each other. It doesn't have to be mass infection or total lockdown, zero COVID, all the boogeymen that people seem to bring up as though there is only one way or the other. There are alternatives. There are things that can happen, okay? And I think we know this because, once again, the Atlantic region has the same economic, social, political systems as other parts of the country, but had very different results. Often people will say, well, it's the economic system that makes it so that we can't have good things, or that the pandemic has to go this bad way because, we live in a particular kind of economy. The Atlantic provinces have the same kind of economy and didn't have the same thing going for all of that time of the 2 years. And I think that small differences can have a big impact. So these small differences may be those things around social solidarity, or collective values, collective care, or that ethical subjectivity. And this is the last word here, it does matter how we act and how we comport ourselves. So the way that we act as individuals and the way that we act as communities and as groups, it matters. So we have responsibility for our actions. Some people have more responsibility, that's true. And I think a lot of the people in leadership, a lot of the people who presume to be our political leaders or are leaders of all sorts of organizations, these are folks that have a lot of responsibility for what's wrong and the way that things are going now. But we, all of us people, also have a responsibility to act and comport ourselves in ways that align with the best of ethical principles. So this injustice that's happening with the pandemic is happening primarily through the way that people are acting and interacting one-on-one. So this is happening out in the terrain of everyday life. And I think that's where things can be changed. So you can connect with me on my website, jonparsons.ca. I've also got a Twitter account that I try to check in on at least once every day. And once again, thank you very much to Kathleen and all the people here at Protect Our Province, New Brunswick, for the great work that you're doing. And I'm happy to answer a few questions.
Great. Oh my gosh, thank you so much. Just my immediate reaction as myself. I see some hand claps in the people's reactions. My reaction from myself, I'm so grateful that you took the time to come here tonight and review that presentation with us and express those thoughts about particularly the situation in Atlantic Canada. I think that for a lot of us in our group, we've tried to have the best summer we possibly could with our kids. Not everyone's kids are out of the woods in terms of some of our members' children are still in childcare. They still had those risks of exposures throughout the summer. But for a lot of us, our kids were out of school. And even though the summer was, I think, more challenging than most people anticipated, it's got nothing on what's coming for us in the school year. And I think that reality is dawning on all of us. And you can just feel the tension and the stress ratcheting up. And every single time, PEI just released this afternoon their plan for school. Nova Scotia just released theirs yesterday. And like the anger, the justified anger on the part of parents, right, who know what's coming, because this is a highly infectious, easily transmissible disease, right? So we've seen this play out already in the spring. We know what's coming. And the fact that nobody in power seems to at all, even in the slightest bit, be willing to take the steps that, it's not like it's a mystery. And that's the hardest part, is this is not a mystery. This isn't like alien abductions are happening and we cannot figure out how to stop them. We know how to stop COVID transmissions. It's extremely, extremely well studied. And so we do have the evidence for the efficacy of respirators. We do have the evidence that, for example, and I meant to mention this in our introduction, that COVID is airborne, which means that the dominant route of transmission is the inhalation route. And that is a cold, hard scientific fact that not a single province or territory in Canada disseminates to the public, nor do they convey that to their departments, which include their education departments, responsible for daycare, early childhood education, kindergarten, all the way up on through to grade 12. They don't apply that or communicate that in their healthcare departments, which includes long-term care, which includes the hospitals. And so then you have the horror of the nosocomial infections, because the infectious diseases and the safety in the hospitals is completely off base because they're not using airborne precautions. So anyway, it's not like it's a mystery, right? It's not like it's alien abductions. We know how to stop the transmissions, and they're just not doing it. So I think that tension and that stress and that anger and dread is really present. And what your presentation has done for me tonight, and I think for other people present as well, is giving us that framework that I think if you're not used to approaching complex situations with a framework like what you described, the background that you have, the different ways of thinking about it all, I think having that framework is going to be really helpful for us as individuals on that terrain of everyday life, as we have to decide, this life is just all these decisions, right? And weighing those risks and like, in your early on in your presentation where you said, well, how does a thoughtful person do this? And that's been, I think, one of the biggest things for me, is realizing that the return to school is literally going to kill people. And it may not kill school students, but the chains of infection that the school students are part of and are generating and accelerating are going to kill people in our provinces. And so as a thoughtful person, right, how do we approach this coming school year? And for those of us who maybe don't have a choice that our kids participate in person in that, right? It's horrible. Anyway, that's just my reaction. So I'll get to you some questions. So the first one that we had received, Teresa sent it to me. And I'm just going to get it up now on my screen here. So the first question, this was from Chris, and I think he's still here actually. So we know that medical practitioners are held to an established ethical standard and are subject to dissociation should they not uphold it. In your research, have you seen any situation where medical practitioners who hold political offices, such as the chief medical officers of health, who provide public advice from a place of implied medical authority, are held to the same ethical standard? That's a really good question, and let me know if you need like a repeat of it. I think the basis of that being that the medical practitioners do have an established ethical standard, and that when they're practicing in a medical capacity, they can be, there's a process for that if they're in breach of that. And then where you have a medical practitioner in a political office, have you ever seen an instance of them being held to that standard?
Okay, well, the second part of the question first, no, I've never seen an instant of them being held to the standards that they ought to be held to. And there is, I won't name the particular medical officer, but in one of the provinces right now, there's some really interesting research being done on the emergency authorizations and the research ethics that have been used in order to conduct a number of trials and studies. Because remember, a lot of these medical officers are also active researchers. And you can look them up on Google Scholar and you can see the work that they've done. A lot of work over the course of the pandemic has been done under emergency authorizations, so not having to pass the same ethics reviews, or in sometimes having ethics reviews kind of waived in order to get particular kinds of research done and particular kinds of studies done. So there is a lot of analysis being done on this in the bioethics community. Bioethics is a part of applied ethics that specifically looks at medicine or the application of ethics to human health in a lot of circumstances. So there are people who are doing a lot of work on this. My view is that the people who are doing the research and the people who are in the positions of authority and the people who are making these decisions and driving a lot of the public policy have a great deal of responsibility for what's happened in this country throughout the pandemic. And I think that, it's difficult to talk about because so many of the folks that I have worked with and interacted with throughout the pandemic have been medical doctors. And there's a lot of medical doctors who are out there doing really important work, and a lot of scientific researchers who are out there doing really important work. So it's difficult sometimes to have conversations about bad practices that are happening in medical fields or in scientific research fields. So it's a tough conversation to have in some ways because, a lot of these folks too and doctors and medical practitioners and researchers of all kinds have been subjected to a lot of abuse throughout the pandemic as well. So there's nothing easy about it, but my view is that the folks with the most power and in these decision-making positions who are driving the policy are the ones who have the most responsibility for what has happened in this country and in the specific provinces. So I hope I've been able to touch on your question there.
Yeah, and Chris, I think, is still here. So if you had any response to that, Chris, then feel free to type it in the chat for sure. I'll get to a couple more questions from the chat. So there was one submitted from Jessica. So her question is, how do we have hope? Oh, thank you, Jon, by the way, for answering that question. How do we have hope? How do I give hope to my children when the society has cast their health needs aside, especially my child with disabilities? Where do we find hope in this hardship?
Yeah, I think that the hope that we can, well, sometimes a little hope is all we get, right? But I think that the hope that we can find is in, once again, organizations like this one, and is in seeing that there are people out there who are still fighting, and seeing that there are people who are trying to organize and who are doing whatever they can to try to make things better and to try to keep as many people safe as possible. And I think, once again, through the ethics framework that I work in, it is miraculous that people try. And I think sometimes that's where I find the bit of hope that I somehow have managed to retain through this is, once again, that there are people who try, and there are people who are out there organizing and who are out there spreading the information and who are trying to get people together. We may not win all the time, and we may not win very often, but it doesn't dissuade those people who are going to try anyways. And I think that, for me, is where that bit of hope comes from. I think that sometimes I'm not one of those blind optimists who just says, oh, everything's just going to be great, it's just going to work out on its own. I don't believe that. I think that it's up to us, and that it's up to us to get organized, and it's up to us to do whatever we can. And I know that's a big demand on a lot of people, because I know a lot of people just getting by is sometimes the best that they can do. But, I really do think that we are the ones who have to make change. We are the ones who have to figure out ways to make things better, because nobody else is going to do it for us. So that I think is where the hope comes from.
Just speaking to one of your research interests with knowledge mobilization is, I think, how you put it, which is interesting. Like, I haven't been involved in that academic world for a while, but that's a new term for me, knowledge mobilization. When I was in school, we talked about knowledge translation. And so I really like that idea of, like, not just translating it, but putting it to use, right? And that's something that gives me hope. The dark side of this is that, wow, clearly, so I'm an information professional, clearly the chief medical officer of health had information needs, right? They were curious about what is the effectiveness of these various interventions, right? How important are masks? How important is this, right? How do they needed to know the effectiveness. It's horrifying to me that it would appear that information professionals were not consulted. Like, what is the purpose of my profession if during a pandemic that affects all people, information professionals were not consulted? Because if you're not going to consult them when something affects everybody, why are we here, right? But on the flip side of that, the hope part is, in our group of volunteers, we've had lay people, non-science backgrounds, right, produce excellent, high quality pieces of knowledge synthesis. Someone in our group made a pamphlet, really synthesizing a lot of facts and knowledge and helpful information. Someone in our group made a Safe September toolkit, which, I looked it over and was basically like, I can't find anything in here to correct. And, versus when you load up the provincial website, and it's just like, oh, you got the mode of transmission isn't there, and the length of time you test positive is totally wrong. You know what I mean? Like, it is quite amazing to me that out of our group of just people who came together, that capacity for really accurate learning and communication absolutely seems to be there. So yeah, I think that's very hopeful. I'll do one more question from the chat before turning the microphone over to John Osborne, who has his hand raised. So this question is from Anthony. How do you work with active nihilists? There seems to be so much radicalization of that particular section. Great question.
I don't think that you can work with everybody. And I'm not the kind who thinks that we have to make space and time for everybody's views. Some people aren't going to be convinced. And I think sometimes you got to go with your gut on it. Like, so if it's a family member and you think it's worth it, you think it's worth taking the time to do it and to try to go through something like that, okay. But I don't think that everybody is going to be convinced. And I think a lot of people who are in that camp, in that sort of active nihilists, they're impervious to information, except the information that they seem to want to get their hands on. But there is, like, once again, if there's someone that you care to go through it with and that you think it's important to do, the strategy I employ is an old communications hack. ABC, acknowledge, bridge, communicate. So try to acknowledge the reasonable and real reasons that people sometimes latch on to particular views. So anti-vax views, a lot of the anti-mandate views, there's reasons that people find their way into some of this. So it's not just irrationality all the time. Like there's always some kernel of truth that draws somebody into something. So I think acknowledging that first is the way to open the door. Then you find a way to bridge to what it is that you want to talk about and sort of butter them up or get them into a position where maybe they're going to try to listen to what it is that you're going to say. And then you try to communicate your views, why you think it's important, why you want to tell them those views, like why you want to share your views with them because you care, right? And you think it's worth taking the time to talk to them about it. So ABC, that's my strategy. But again, you really have to decide if it's worth it with some of these conversations.
Thank you. That's helpful. It's wonderful. There's a few more questions in the chat. There's maybe about 3 or 4 more questions. I did set this to run until 8:15, just in case this happened. I'll turn the microphone over to John Osborne for a moment here so he can ask his question. And then maybe we can just finish those last few questions from the chat, if that's okay. Great. Okay. Go ahead, John. I'll get you to unmute.
Hi there. Thank you very much. Just wanted to thank you for the presentation, and I appreciate how you spell your first name. There needs to be more of us. My question is sort of about unions in general. I have a lot of experience with unions. And when you were talking about like a sense of collective responsibility and caring for one another, I've always found that to be very present in unions, like very similar to the Nova Scotia Strong. Well, they're union proud, union strong. But I find that they've almost come into like a conflict of caring, because similar to how Canadian society is divided, so is their membership divided. So they almost find themselves now where they support what they do. The one I'm thinking of is a federal public service union. They find themselves in this dichotomy of supporting vaccine requirements in the workplace, but also filing grievances for people who refuse to get the vaccine and that they should be paid. And, you know, I get the rationale there that everyone who pays union dues deserves a defense and all of that, but I just don't know how to reach a union leadership that I think there is fertile ground there on talking about ethics and caring about everybody, and that, you know, showing them that, you know, if these projections on long COVID of like 1 in 8 or of COVID infections are going to turn into long COVID and it's going to decimate your workforce, then the unions need to be acting on this now. And I just, maybe it's similar to the nihilist question, but I just don't know how to fertilize that ground in an effective manner. And I just wondered if you had any comments on that.
Well, I'm a big supporter of unions and labor movement, and I've always found that unions are going to be most effective when people are doing something. So I've always liked when unions are getting involved in causes, and of course I wish that they were a lot more vocal and involved in these particular causes. I wonder if a part of the problem is that unions over the years have themselves become corporatized and in some ways have been severely weakened over the last 20, 30 years of what is sometimes called neoliberalism in this country. So unions are not maybe what they used to be. I think, though, that when unions are given permission to get up on their feet and to start moving and to start doing things, that they can be highly effective, but that one of the best ways to get them moving is when they see the people moving first. So sometimes I think it's up to the grassroots to sort of take the initiative and then try to charge up the unions, from the streets or from the grassroots or from the organizing that people themselves are doing. So that's always been my interest, and my starting point has been to work with the grassroots and to work with people out in the communities, and then to try to finagle the unions into whatever it is that we were working on. And I think a similar approach may be able to work here. But you're absolutely right that with this issue, it's very fraught for a lot of labor unions because they have memberships that are in workplaces or who want to be in workplaces in many cases, but are then being put in situations that are unsafe. So they don't quite know how to handle that. And as you say, a lot of the issues that are coming up around the vaccinations or the mandates or whatnot like that. So look, it's not an easy situation for the unions, but my thing always has been we organize and then try to get them moving.
Great, thank you. So I think we have 8 total questions in the chat, and this is the 4th one. So this is from Barry. Our school board makes public statements. We as employees must stay mum. If we speak publicly, we can have repercussions. I am anonymous on Twitter for this reason, nor can I ask students to mask or communicate any concerns to parents. Communicate my concerns to parents. Comments from Jon, please. Thank you, everyone, for great questions, by the way.
Yeah, it's horrible, and people are being put in precarious situations, personally and professionally, by trying to speak out or by trying to keep themselves and their families and their communities safe. And that in itself, I think, is a major injustice and is exactly part of this collapse of social relations that I talk about. That's a big part of it, that people just are not allowed to express their views. So, I mean, again, I don't have a lot of easy answers, and I'm not the type to just say optimism is going to win out all the time. Like you've said, you've found a way to get anonymous on Twitter. You found a way to get involved with an organization like this one. And maybe there's ways that you can do that without, having to be loud or having to get out in people's faces or things like that. Sometimes I find as well that if we can find even small numbers of like-minded people, so in your own community or in your own workplace or wherever it may be, that it's important to try to organize, or for your school or, your kids' school or whatever it is, if we get small numbers of people together, we can start trying to do things then, and we can start trying to work together, give courage to one another, rely on one another, and then hopefully things snowball. I mean, that's how people have organized for thousands of years, as far as I understand it, to fight against injustice. And I think that's what this is. I really do. I think this is, in many ways, a social justice issue. This is, exactly one of those cases where people getting organized and fighting back is what's called for in whatever way that we can. And I tell you, one particular group of people who I think have an awful lot to teach us in a situation like this is the disability community, because disabled people have been organizing and doing so without meeting face to face for a generation at least. So the disability rights movement, I think there's a lot to learn from them and from what disabled people have done in order to win some significant things over the past couple of decades. So, we could be reaching out, we could be trying to learn from disability communities about how to move forward and how to best organize. So there's lots of work to do. I feel there's lots of things that we can all be doing. Some of it's a matter of trying to get creative, think a bit outside the box, and see how we can move forward.
Thank you. That's a wonderful answer. Okay, the next question, number 5 from Sarah. Will there be retrospective ethics reviews of how the province is managed?
I mean, you'd expect that, wouldn't you? You'd expect that there would be commissions and committees and, you know, big reviews in every province of what's happened, but I don't think there's much appetite for it. I don't think the governments have much appetite for it, and I don't think a lot of the public has much appetite for it right now. A lot of people, it seems to me, just want to forget that anything has even happened. And I think that was easy to predict. You know, when we sort of have seen the way things have been going for the last year, maybe a little bit more, a little bit less in Atlantic Canada, perhaps. But, you know, there should be inquiries. There should be retrospective looks at the way that a lot of this ethics, research ethics has happened throughout the pandemic. It should happen. Whether it will, your guess is as good as mine on that one. I mean, maybe that's also something that people should be calling for, those sorts of things. I don't know that I think it's the most effective way to make change, because those sorts of things, I don't know that they actually do anything in the end, but they should happen. They should be happening, yes.
And that is something that we can influence, is by calling for these things and setting them in motion. Thanks, Jon. I feel like I'm like pushing you through all these questions. I hope you're doing okay. This is really, it's awesome to have somebody thoughtful to ask these things of. It's great. So the next question says, Nova Scotia's Conservative government decided in March 2022 that the economy was more important than our health. I'm just going to read this verbatim. So the honkers won and everything opened up. But now the fallacy of that logic is becoming obvious. There are so many sick people. The economy is getting crippled. Suggestions on getting that message to the power people to understand something they are actively annihilating.
Well, they don't seem to really want to hear that message, do they? I think a lot of folks have painted themselves into a corner where they feel like now, if they were to change course, that would impact them personally and professionally. Now, they could be politicians, or they could be other sorts of policymakers, or people in positions in all sorts of organizations who have sort of made these prognostications, or made these, removed these restrictions, or done whatever restrictions, as they call them, or done whatever it is that they've done, and they feel like if they were to change course, that would reflect on them personally and professionally. So some of those folks, I think, maybe even realize that mistakes have been made and cannot backtrack on them, or cannot appear to have backtracked. So what can we do? Again, I think we got to get organized. We got to make it so that it's easier to do that than to sort of face the wrath of the people. Again, that starts like with these kind of things, with people getting together, small groups of people, getting organized, putting pressure. And I think sometimes too, a good question to ask is, how are we going to make things change? So one of the most common things that people do when they try to start organizing is they get a load of information together. Now, having the information is really important and is really good, but information and information sharing is not in itself a theory of political change, right? Political change happens because of power. So we need to create power by getting enough people together, and by getting enough people on the same page that then they can't be ignored. So we need to find ways to build power in order to make change happen. So it's not just having the information, it's then using it in order to grow our numbers and to grow our capacity. So sometimes I think it's worth getting people together, even just to show how many people we have, because right now what we've got is a lot of disconnected people, a lot of people who are sort of out on their own, thinking that they're alone, and not realizing until they see things like this, or they go on social media somewhere and see, oh, there's other people who think like me, and then don't really know how to get together or what they can do next. So, I think building power in those ways is something that can be done to push back against some of these politicians who, once again, seem to have a vested interest in not reversing course, even though it's becoming obvious that it's the right thing to do.
Thank you. I'm really glad this is being recorded because that's something I think I'm going to go back and listen to again, because it's really helpful. So I'm just going to jump ahead in the line a little bit. Somebody asked where to buy your book, and I can answer that. There's a wonderful charity. I mean, you might want to answer it too, Jon, but there's a wonderful charity in Canada called Donate a Mask, and they've been fulfilling people's requests for rapid tests and respirators. So if you happen to be on this call tonight and you had not heard of Donate a Mask, just look them up, Donate a Mask Canada. And if you have money to spare, you can purchase things such as Jon's book. That's where I bought it. And it came as a electronic publication format so that I can read it on my phone. Or I guess you could check into with your local bookstores. But the Donate a Mask charity allows you to buy it from them, and you can also request free masks and tests. Go ahead, Jon. Sorry.
If I may say too that all the proceeds from the sales of the book go to Donate a Mask. So every time you buy a book there, they are sending masks then out to people who need them. So they're a wonderful organization, and I've been very happy to work with them. If you want to get a print copy of the book, you can have your local library request one. And otherwise, if you want to, get your own print copy that's not in the library, unfortunately, you have to go through Amazon. So do the Donate a Mask one if you don't mind reading an electronic copy, and then we can all help get masks to folks who need them.
That's awesome. Thank you so much. Yeah, maybe someone can copy and paste the Donate a Mask URL into the chat. The next question here, sorry, I just scrolled and messed it up. Okay, so we all have experiences with people who have been misinformed from official sources. 90 days positive on a rat, the rapid test, that the misinformation that was out there that you would continue to test positive for 90 days, no reinfection, like when they denied that reinfections were going to happen. So their understanding of the situation is different. How do we incorporate that reality into your ethical model? I guess these people who have erroneously heard from official, supposed to be reputable sources, right? How do we use it to get them to seek their own evidence? Okay, perfect.
I mean, look, I didn't want to make it sound like having the information and sharing the information wasn't important. Like we definitely need the information, and we need to share the information. Once again, some people, it's going to be tough to share information with them. It seems like a lot of folks live in bubbles. I've found that I try not to get involved in a lot of bickering and a lot of sort of negativity. I just try to keep it as sort of like, thank you, I appreciate your comment, and here's this information if you'd like to read it. It's sort of like you bring it to people, you offer it to them in the nicest way that you can, and then you sort of hope that they will take it to heart. I do think that, for me, it always starts with empathy and trying to understand. So I always try to empathize with the people that I'm speaking with and see them as decent human beings, who have their own concerns and their own lives. And I think that's a great place to start with any conversation where you're trying to get somebody to change your mind or to take a look at some new information, if that's what the goal is, right?
I think it does get difficult and confusing for us when we have these experiences where people have consulted 811 or public health, and then they kind of get this information back from this reputable source, and then it's like, oh, like it. I know from experience of trying to talk to people about airborne transmission in October 2021 that my preamble was as long as my message, which was like, I know I'm going to sound really out to lunch, but and now thankfully there's more awareness, so we can cut that preamble because it's so proven now. But yeah, it's so hard when you're trying to and a lot of people I think hate to be the one to say, oh, the government's wrong. A lot of us 2 years ago wouldn't have been coming from that perspective. So there's I think this might be the last question. So somebody wanted to kind of piggyback on what I had said about information professionals. Why do our public health policymakers seem to ignore information specialists, social scientists, HVAC specialists, engineers, etc., for issues as complex as behavioral and infrastructure changes for reducing transmission of disease? Why have we placed the MD as the sole guardian of health promotion? Great question.
Yeah. And again, I think that when I've tried to have discussions about this, it has not always gone well, because it sometimes comes off as though I'm attacking medical professionals or scientific researchers or things like that. And I'm not, because I've worked with a ton of really great doctors and researchers all through this pandemic and before, and I'm sure I will into the future. But the medical field, there's a great paper, a great chapter of a book out there written by an author named Susan Wendell called The Social and Cognitive Authority of Medicine. And essentially what Wendell says is that doctors today and the medical field generally has been elevated to the same sort of level that maybe lawyers previously were, or in a generation ago in Victorian England, maybe the poets were. What a great time that must have been. But doctors are asked questions and are asked to weigh in on things that go way outside the purview of medicine. So all you need to do is Google, how worried should we be about COVID? And you'll get 10,000 articles where doctors tell people how they ought to behave and how worried they ought to be about COVID or things like that. When really what doctors ought to be doing is providing the information that people need about the virus itself, about what it does to your body. The questions about how we should behave, or how we ought to comport ourselves as decent people in society, that's really not up to doctors to say. Now, again, a lot of doctors and medical professionals will bristle at, if you say that to them, they won't always be very happy. And I understand why. But in many ways, it's easy to look at who has been quoted in all the articles throughout the pandemic. Who is the people who have been given the microphone? Who has this whole narrative been told through? So one of the great journalists out there today is Ed Young, and he won a Pulitzer for his work. He did a great talk at the University of British Columbia earlier this year or late last year. You can look it up, where he spoke about how he has approached reporting the pandemic. And he specifically said that any article where he quotes a medical doctor, he makes sure to quote somebody from the humanities or social sciences, or somebody from another field or another discipline, or to interview a disabled person alongside the doctor that he's talking to get the lived experience of what people have gone through with COVID. So it's not just this sort of medicalized and scientific discourse about the pandemic. And he criticizes other journalists. He's one of the best journalists on earth. And he criticizes other journalists for giving the microphone only to certain people. And I think that is, in retrospect, something that has been a huge problem throughout the entire pandemic. And once again, the reason that I have purposefully tried to interject this view of applied ethics right from March of 2020, because it was obvious that this is what was going to happen. There's a bit of a tangent, but a great book about the media take on the pandemic in Canada is by Nora Loretto. Nora is a great writer, and she put together a book called Spin Doctors. So I want you to get my book, but I also want you to get Nora's book if you want to read the way that journalism has sort of mobilized this individualistic and scientific narrative around the pandemic. So she's done great work. And Ed Young's talk that he gave at UBC, I highly recommend to anyone who wants to get like a real good snapshot of the way that the media has promoted particular voices and not others, right? So I hope I've hit on your question, but all these folks that you list, the social scientists, HVAC specialists, the engineers, I would love to see more articles coming out that would be talking about air purification, or the way that there's so many things that we could be doing, even just from a purely engineering point of view, to deal with this, that wouldn't even inconvenience folks with having to wear their masks or whatnot. So yeah, we need other voices to get involved in this. But if you look at the way that the narrative in the media has worked on this, it's been the same voices over and over again, the same medical perspective.
Oh yeah, and sometimes these people list their op-eds and it's like, okay, did you do anything last year other than write op-eds that were pretty non-factual? There is one more question, and I would just like to say about Ed Young. He's a very dynamic speaker. I did watch some of his talk, and he's wearing a respirator while he's delivering it, and he was great. He also mentioned that every time he writes a piece, he tries to talk to, like, half the people he interviews, he talks to people he's never spoken to before, compared to going back to the same sources. So I appreciated that journalistic perspective too. So this is the last question, and I really thank you for this extra time you've spent with us tonight. And this question reads, I always come back to the informed consent issue. How can people judge if engaging in certain activities is worth the risk of infection when the long-term consequences haven't been explained by our authorities?
Yeah, and I've heard this also discussed in terms of the precautionary principle, and I think that's another good way to think about this as well. But the informed consent does not exist. A certain form of consent has been manufactured, where people believe that they have the information that they need in order to make good decisions, but they don't. I think the information is selective at best, and at worst is outright wrong. So yeah, there is no informed consent for what's happening. The mass infection that's taking place is in many ways, an injustice on the one hand, but it borders on crime. I try not to sound over the top in some of what I write or in the way that I communicate on social media, but yeah, there's no consent has been granted for what's happening with mass infection. And people are not being given a choice. Even people who do know and who have good information, you cannot avoid, because it's been made that way, right? It's been made so that you cannot stay safe, no matter how much you might want to. They say, oh, well, if you want to wear a mask, go ahead and wear one. I mean, this is nonsense. Like, it's so disturbing the way that things are right now, and the way that people have not consented to any of this whatsoever. So what we ought to be doing, of course, is employing precaution. So we don't know what the long-term consequences of this mass infection and reinfection are going to be. We ought to be taking an approach based on caution. I think one thing that everybody agrees on is that we all wish this would just be over. I don't think anyone is going to argue about that, or maybe a couple of people will, but not a whole lot of folks. So everyone does want this to be over, but not everybody is willing to just pretend and embrace some sort of magical thinking to believe that somehow everything's fine when it's not. So, we as people, I think, need to do what we can to get the information out there, get organized, try and make the positive change. Because once again, I don't think nobody's coming to the rescue. Nobody's going to do it for us. So really is up to us.
Thank you so much. And I think that that's a really great sentiment to close on. I am sure that there are so many of us who have had that thought cross our minds over the last 2 years, 2.5 years. When is somebody going to step in, right? When is someone going to stand up and apply the evidence and make some hard decisions here? And I think that that's really important for us to keep in mind as we come into this fall and a new influenza season and a season of increased unmasked, unmitigated contact with schools and activities, that it is up to us. And for people that are here that aren't aware of what our group is doing and the kinds of things that we can offer each other in terms of even just psychologically, a group of friends and people you can chat with who aren't engaging in the game of pretend right now that this isn't happening. And I think even what we're able to offer to each other as far as that goes is significant, as well as the mutual aid that we engage in with sharing masks, rapid tests, Corsi Rosenthal boxes, HEPA filters, directing people to good sources of information, and the journalistic work that our group is doing as far as submitting right to information requests and trying to contact and liaise with the media. We're trying to do so much. And if you weren't aware of that, then you're absolutely welcome to reach out and get in touch. I have saved a copy of the chat that I'm not planning to, there wasn't much said in the chat apart from the excellent questions. I'm not going to publish the chat, but I know there was some stuff shared, good links and names and stuff like that. So I will summarize that because I have it saved. And as I mentioned, tonight's presentation was recorded, so we should all be able to revisit it and share it with others in the days to come. I want to say thank you so much to Jon Parsons for giving us so much of his time tonight. So thank you, Jon. And thank you to everybody who shared this beautiful summer evening together, a really tough topic. And just thank you for your attention and your care and your time. Thank you. Good night, everybody.